Okay, so now we are transitioning into motor learning principles. So this is the part of the class where we'll be going through the different concepts that exist in the motor learning literature, and this is where you want to keep an eye out for being curious about how particular concepts could be applied in clinical settings in order to develop a presentation on that particular topic. So when you're putting these presentations together, you're only going to have 10 minutes for these presentations, which isn't very much time at all. Given that you have a fairly short period of time, at the end of the day, all you really need to do is identify what the principle is, and then be able to describe the research. So as I go through this part of the class, you will see me describing multiple different types of research that are not going to be fundamentally different from the kind of research papers that you're going to come across and that you want to summarize. You'll see that I really don't end up needing to use that many slides in order to do it. And the reason that it doesn't take very many slides is that I take the time to go and try and work out what the essence of the study is, and to only present the stuff that's directly relevant to trying to draw the conclusion on the slides. I would like you to see you guys trying to go through this, the same process. Now, what this potentially means is that giving your presentation is potentially not going to involve just copying and pasting whatever figures you can find inside the paper. You may have to do some work to organize the information itself, to put it in a form that's most easy to understand in the context of what you want to do, which is to get the information across in less than 10 minutes. Okay, so with that said, let's go and look at some motor learning principles. So we're going to start off with what's quite likely the most obvious principle of motor learning. Learning is going to benefit from practice. When we're talking about practice levels, practicing more is going to have more of a benefit on motor learning outcomes. So let's look at a very classic experiment where we're looking at the impact of training on motor learning. So if you look in the bottom left corner of the screen, you can see a hand poised over 5 different buttons, where each finger and the thumb is each balanced on top of a button. In this particular experiment, both your left hand and your right hand are poised in this particular way. So, and directly in front of you is going to be a set of circles, one representing each of your fingers, and those circles are going to light up. So in the example that we've got here, we see 4 lights light up, and in order to do the task as quick as possible, you then have to press down with only those fingers and thumbs that correspond to the lights that were lit up. So this is a little bit like typing, but this is actually like a pretty challenging task. If you have some if you allow a lot of time to be able to do this, and just like think about, okay, this finger, and this thumb, press. It's an easy task. But to actually do it with expertise of seeing the lights press, seeing the lights press, that's a whole different story. Okay, here we see this absolutely bonkers study. So here we have people learning to do this task, and each dot on this graph is going to represent 1,000 trials. So 1,000 times of seeing a light come on, press, seeing a light come on, press. And what you're getting a window into here is the consequences of participants taking a lot of practice, and we're seeing the consequences of that practice unfolding over time. So on the x-axis, we have amount of practice, where we're looking at the number of the number of blocks of trials. Each one has 1,000 trials in it, and then we're seeing reaction time on the y-axis. So right at the beginning of practice, we're seeing it's going to take about 1.25 seconds on average in that first 1,000 trials in order for you to see the lights come on and then press the response. And then all the way down the end, at the other end of practice, we're seeing that people have improved to the point that in under half a second they can make the same response. So light come on, press. Light come on, press. I mean, it's a pretty fast turnaround. Okay, so one of the things that we can take away from this type of experiment is what's called the logarithmic law of practice. And what we learn from the logarithmic law of practice is we begin to learn something about the nature of the relationship between the level of performance you're achieving and the amount of practice that you're engaging in. So the most basic thing that we see is that more improvement in task performance improves with more practice. That you practice more, you're gonna keep getting better. But the gains of improvement are going to be logarithmic. So specifically, specifically here, we're going to see an exponential change, which is a type of logarithmic relationship, and we're going to see an exponential decrease. What is it? So I'm sure you're all familiar with an exponential increase, but an exponential decrease is we're going to see very fast decreases, or very fast like gains in reducing reaction time to start off with, and then that's going to get smaller and smaller and smaller and smaller over time. So because we're dealing with an exponential curve, one of the way to mathematically express that is through a logarithmic relationship. So here we see the exact same data plotted where the axes on the side of the graph are logarithmic. So if you look up at the top graph, I'll just put my cursor on the screen. We can see the distance between 0 and 1 is about the same as the distance between 1 and 2. When we come down here, we see that we're actually seeing a compression of the differences that we're seeing here. So we've actually changed the axes to create logarithmic axes. Now, the reason that we say that we have a logarithmic relationship is that when you create this graph in a way that you're expressing them as logarithms, we end up seeing a straight line. That the data is a perfect fit to the in this new space where we have logarithmic axes. Okay, so one of the things I'll scatter throughout this talk is trying to make some simple connections between the particular principle that we're looking at and some connections to PT and particular interventions. So a simple interpretation of the motivation for constraint-induced movement therapy. Actually, let me expand the screen so I can see all of you at the same time. Okay, by show of hands, does anybody not know what constraint-induced movement therapy is? Okay, so we've got at least one. Okay, so when we're looking at constraint-induced movement therapy, the basic idea is that you are going to constrain the patient in a particular way so as to promote a particular type of activity, or in this context, a particular type of practice. So here we have an image of a patient that is recovering from a stroke, And in order to facilitate the recovery, what's been done here is that effectively a large oven mitt has been put over her non-affected limb. Now, what does this mean? When you put, you're going to, by taping an oven mitt over this limb, you're going to reduce what the non-affected limb can actually do, and you're therefore going to force the patient to use the affected limb more often. Now, when you do this, what's the consequence? The consequence is that they will, in order to do the things they want to do, they're going to have to use their affected limb more frequently. Therefore, they'll get more practice, and therefore, they will get gains in function back much faster. Okay, so let's move to the next like principle that if you were to just list like what are the obvious principles, the next one is feedback. So we're gonna start to pull apart what we might mean by feedback and unpack some terms that will give us some language for describing the particular nature of feedback that might be given in a particular situation, and give us terms so we can talk about the benefits of making choices about the type of feedback that's given. So the two main types of movement-produced feedback are going to be intrinsic feedback or extrinsic feedback. When we're talking about intrinsic feedback, we're really talking about the kind of feedback that will be intrinsically generated by virtue of performing the action. So the sensory consequences of performing the action are going to be the major source of intrinsic feedback. Your ability to perceive what's just unfolded when you've tried to perform an action. Extrinsic feedback is more often going to be additional things that are going to be provided and provided externally. So examples of sensory feedback might be auditory feedback, like so performing a movement, like getting a sense of how it sounds, getting a sense of what the visual consequences of performing the action are, and haptically this is going to be a key component. The learning how a successful or unsuccessful movement feels and what the haptic consequences are. So when we're talking about extrinsic feedback, we could be talking about knowledge of performance and knowledge of results, and we could be talking about augmented sensory feedback or biofeedback. We're going to focus most upon knowledge of performance and knowledge of results, which we'll define in specific detail in the next few slides. Okay, so augmented feedback. So augmented feedback can comprise a description of the outcome of the movement, or it could comprise a description of the movement pattern itself. And we'll be looking at some research that actually has examples of both of these. So in terms of trying to build a description of what the characteristics of augmented feedback are, we can talk about the general form of the feedback, which could be verbal feedback or non-verbal feedback. And we could also talk about the timing of the feedback. So the feedback could be given concurrently, so you're getting the feedback as you're doing the movement. That's the most common in biofeedback applications. The timing of it could be terminal, so that you get the feedback immediately at the moment that you finish trying to perform the action, or it could be delayed, where you receive the feedback at a certain time afterwards. So when we're looking at the characteristics, we're laying out these characteristics because these characteristics are going to map onto research that's investigating the consequences of whether or not changing these characteristics has positive or negative consequences for how effective and how fast the motor learning process is going to be. So let's look at some types of augmented feedback. So we've got knowledge of results on one side and knowledge of performance on the other. So knowledge of results concerns the information about the outcome of the movement. You've produced an action that has a particular goal. What's the outcome of that action with respect to the goal that the action is organized around? So this could take the form of verbal feedback, or terminal feedback about the degree to which the goal was achieved. With respect to knowledge of performance, here we're really focused on information about the characteristics of the movement. So here we're not really talking about to what degree the movement was effective with respect to the goal, but we're talking about the specifics of the movement. Where you might be identifying particular sub-qualities of the action that may in and of themselves be related to the goal, but you're going to be giving feedback about them somewhat independent of the goal, with the idea of trying to get the actor to focus on those characteristics and improve them, and hopefully have a particular style of performance that will create more optimal outcomes. Okay, so here we're talking about qualities of the behavior. So in gait training, a particular aspect of the kinematics of the movement, or in stepping, commenting upon the degree to which the foot is pulled up off of the ground, and identifying qualities that could contribute to the particular type of performance that was observed. Okay, so let's look at some specific examples. So let's go back to the example of a golf instructor providing feedback to a student. One of the reasons that I have used golf as an example is that golf is one of the more heavily studied things in the literature, and a lot of the research that exists and knowledge that's been gained has actually been gained in that context. Okay, so what would knowledge of results look like? Your shot went right into the rough. So we're learning about the outcome in relationship to the particular goal of the practitioner trying to get the ball to a particular part of down the fairway or on the green. When we're looking at knowledge of performance, a feedback might be you didn't take your backswing far enough before you began your downswing. So here you can see the actor is going to the learner is going to end up focusing on exactly what the pattern of motion that they're going to be producing is actually going to be. And these distinctions fit like pretty much exactly to what we were talking about last class with the distinction between intrinsic and extrinsic feedback. So in the case of a sprinter running 100 meters, you run the 100 meters, you look over to the clock, you will get knowledge of results. If you play a video to the sprinter back, where they're able to focus upon exactly how they were moving and the specifics of their coordination patterns during the action, then we're talking about knowledge of performance. Okay, so let's look at some functions of feedback. In general, feedback serves at least 4 important functions: reinforcement, motivation, punishment, and gaining information or knowledge about the action. So let's delve into this a little bit. So let's start by thinking about feedback as positive reinforcement, which would, in the context of operant conditioning, would act to strengthen the correct performance. So the law of effect, so connected to operant conditioning, is going to tell us that positive outcomes will increase the likelihood that the produced movement will be produced in the future under the same or similar conditions. So if you have someone producing the movement multiple times, if you positively reinforce the movements that are closer to the desired movement, you are actually going to reinforce. There's actually going to be you're going to be promoting neural reorganization that will promote the stabilization of the more effective movement patterns. So, an example of internal feedback. So you hit a soccer ball. It goes exactly where you wanted it to go. The seeing that consequence, seeing that outcome of your movement, talking in operant conditioning language again, is going to lead to internal feedback and internal reinforcement. In the case of augmented feedback, providing a verbal compliment such as "good try" or "great move" is going to tap into the same basic mechanism. So, in order for feedback to serve as positive reinforcement, it must follow shortly after the movement. So what we learn from like classical operant conditioning studies is that the timing of the reinforcement must bear a particular relationship to the action that's going to be reinforced. And I'll actually show you some specific research examples in a slide or two's time that have demonstrated that. Okay, so next we've got feedback as motivation, and here we've got some research that has highlighted the fact that the success or failure of a past performance is going to be a key mediator of a person's self-perceptions regarding their own ability. So your experiences of positive or negative outcomes is going to impact your self-perception regarding your own ability. So what's the clinical implication of this? So augmented feedback is going to be able to influence a person's feelings of success or failure. And that's important because that can be a significant factor influencing whether or not a person will continue or stop participating in a particular aspect. So your bedside manner, so to speak, in the clinic and how you're interacting with the patient really does have an impact upon the likelihood of getting positive outcomes from the intervention. Okay, so let's think about feedback as information to correct performance errors. So feedback has the potential to carry information about the particular causes of an error, the outcome of a skilled performance, what a correct movement pattern felt like. So so you get feedback on, okay, the way that you're doing the action at the moment is really in the ballpark of where you want to be. If the patient knows that, they're going to be able to attend to what that movement feels like. They're going to be able to get intrinsic feedback that's going to help reinforce and support the ability to reproduce that more effective pattern in the future. And it's also going to carry in potentially information about the changes in technique that could be brought to bear in order to correct the errors. Elaborating on that, the reasons why particular changes are being recommended. So let's think about feedback as information to correct performance errors some more. So is augmented feedback valuable? Like, as practitioners of evidence-based practice, it should be the first thing you would want to ask. And when you're going into the literature for your presentations, the answer that you want to get from your research is there some evidence that a particular application of a learning principle has some signs of being useful. So people can learn most skills without augmented feedback. Why we care about these principles is that applying these principles may allow an individual to learn the skills or to recover function more quickly if they receive the additional feedback. So then the question is, does augmented feedback help you learn the skill more quickly? Now, here's some like general rules of thumb. But they're pretty broad, but they're useful for helping guide your thinking. So we've got a no answer and a yes answer. So augmented feedback is less likely to help you learn a skill more quickly in situations when the feedback that you're providing, the augmented feedback that you're supplying, is going to be redundant with the intrinsic feedback that the patient or the athlete is actually receiving. It's also going to be less useful if the skill that you're focusing on has a detectable external reference in the environment. So one of the areas that this has been shown in is the context of tracking tasks, where you're actually performing a targeting task where you're trying to track a particular movement with your own movements, and in that particular case, the information that you're getting from your senses, you're visually able to see how your movements are lining up with the target that you have. So you're getting a lot of information from vision about how effective the action is. Providing additional information on top of that is potentially redundant, but in particular circumstances, which that we'll actually elaborate on the S side. Okay, augmented feedback is likely to help you learn a skill more quickly in situations where sensory information or specific sensory information that's not available in a particular context is unavailable to you. So the most extreme case would be doing a tracking task where you're asked to produce a particular type of movement and that would go along with the movement of a target that you can't see. Then getting augmented feedback is going to be super useful. So then getting to the point I was making at the bottom, there's going to be cases where intrinsic feedback is available, but the learner hasn't got to a stage where they can more effectively use it. They can effectively use it. So you can see or you can feel how you're moving with respect to a particular goal, but that you have the potential to see or feel of it, but you haven't learned to be able to effectively interpret that information with respect to if you're effectively performing the action or not effectively performing the action. So examples of situations where augmented feedback is likely to be a lot more useful is when a learner's sensory pathways are more impaired due to injury, accident, age, or disease. Okay, so let's look at some specific research. So here we have some research looking at learning a one-handed basketball set shot with your non-dominant hand. So for a lot of people, this is going to be a pretty novel skill, even if they played basketball for a while. And we're going to have two groups in this particular research. Group one is only going, both are going to receive some form of augmented feedback, but one is only going to receive verbal encouragements, and the other is going to receive verbal knowledge of performance. They're going to receive specific comments related to their stance and related to the specifics of the kind of movement errors that they're performing that the expert basketball coaches are providing to them. Okay, so here's the type of graph that we're going to see multiple times in this part of the class. We've got the outcome measure on the y-axis. Here we've got the average number of points. So this means the higher up you are on the y-axis, the more skilled you're being. And then on the x-axis, we've got a first set of trials where feedback is going to be given. So this is early in practice. And then we've got a rest period. So where we're going to end up looking at things like transfer and retention after a particular break. And we're going to be looking at retention, because in these later trials, we're not actually going to give the feedback anymore. So what I want you to notice in these particular graphs is that in the on the left-hand side of the graph, we're seeing there's some trials where the where we're seeing verbal knowledge of performance, so the hollow circles being a bit larger than only the verbal encouragement. and other trials where we're not really seeing a difference. So what we're seeing during the early in practice is we're not seeing a reliable difference between whether or not you received just encouragement or whether or not you've actually received pointers on exactly how you should be changing your movement. Now, the key thing that we care about, so again, for learning to occur, it has to be a relatively permanent change in performance. In the retention trials, we end up seeing that if you have received the pointers, the verbal knowledge of performance, your ability to score more points is reliably higher. So what we see is we see a bit of an improvement during practice with receiving the pointers, but at retention we end up seeing reliable improvements from a particular type of feedback. That verbal encouragement alone is not being as effective as verbal knowledge of performance in this particular task. Okay, here's another classic study in this area. So this is some research from 1945, and this is some research studying the training of industrial machine operators to be able to precisely and quickly cut thin discs of tungsten using a machine that uses a foot pedal. Now, what we care about here is the participants' ability to be trained to deliver a particular pattern of forces with their feet that will deliver the forces required to create a product that's actually like functional. What we care about is through training, these people learning to produce fast, accurate, and rhythmic patterns of movement with both their hands and their feet in order to create the desired outcome. Okay, so in this research, they compared traditional training, which is the standard way that people coming into the factory would be trained, which is you get put in front of the machine. You might be given some like basic instruction upon how the machine worked, but you are effectively going to learn by trial and error. So sometimes you try it, and the disc that you were cutting would end up being a hot mess. The other times you try it, the cutting disc that you would be using would break apart, and based upon your experience of discovering yourself what worked, what didn't work, you would see a steady increase in that factory worker's ability to perform the task. In this study, they investigated the potential utility of a particular type of augmented feedback training. So what they did is that they created tracings of the particular type of patterns of motion that were being created by an expert and by the operator each time they used the machine. So they had a reference to look at of, okay, this is the pattern that you should be creating if you're going to be an expert, and that will create the perfect disc. And this is the pattern that you created. So after you've cut a few discs, you get to be able to see how the way that you're doing the task compares to the expert, and use that as a way to guide how you would be modifying the way that you're doing the task. Okay, so here are the results. After 11 weeks of this particular type of augmented feedback training, the performance, and in this case it's evaluated by the quality of the tungsten discs that they cut and the number of discs that they cut, was equal to the level of achievement that was reached by the people using trial and error after 5 months. So here we have a clear-cut example where providing a particular type of feedback transformed how quickly people can learn to do the task. So using another metric, the number of broken cutting wheels that we saw reduced to almost 0 in the group that received the augmented feedback. So, and this was equivalent, this is equivalent to the level that was observed after the people normally learning this task. It would take them 9 months. So We got a beautiful example here of the potential of the right type of feedback to transform how quickly you can learn things. Okay, so so one of the questions that you're going to be faced with, okay, we've got some evidence that giving feedback of a certain type is good. What type of feedback is going to be the best type of feedback to give in a particular context, and how should I give that feedback? So here we see we're going to talk about some research that compared the giving knowledge of performance versus knowledge of results in the context of training university students to perform an effective overhand serve in volleyball. So here's an example of knowledge of results. You perform the volleyball serve, and then you get information after you've performed the action about the spatial precision of the movement, about the amount of ball rotation that was achieved, and about the flight path of the ball. Alternatively, you could look at giving knowledge of performance. So here, an expert coach is going to give feedback on what they believe the most important error that they're seeing in the performance would be that the player in training should attend to. So what they should focus might differ between participants, but what's important is that they're being given information on an aspect of the movement pattern that they're producing. So, like if they're throwing the ball high enough, if they're arching their body right, and so on. In this particular study, they saw that both knowledge of performance and knowledge of results aided learning to serve effectively. They both had value. But what they also found is that for a subset of the players that were being trained, knowledge of performance was significantly more valuable to those players than knowledge of results. So what we're getting a hint at here is that there's, in this particular situation, there's some potential individual differences in learning styles or where people are in their learning process that would make one type of feedback more valuable than the other. Although what the difference is, it wasn't unpacked in this study. Okay, let's look at another study. So here we have a study where athletes are being trained to throw a softball as far as they can with their non-dominant arm. Again, we're looking at the non-dominant arm, so we can, because we're investigating the utility of training principles, and we want to start out with a skill that has more room for improvement, so we can actually see it clearly in the results. Okay, so subjects throw the softball as far as they can. So we look at some different types of feedback. So we can either have knowledge of results, and in this particular case, the subjects are going to be provided a videotape replay that's going to reveal how far the ball is being thrown after they've thrown it. So they're getting knowledge of the outcome of the movement that they performed. The other feedback we're looking at is knowledge of performance, and the subjects are going to receive verbally presented techniques similar to before that are going to be comments about the specifics of the technique that they're using. Okay, what they found in this study is that providing knowledge of performance results in better throwing technique. So, in the results of the study, I mean the technique improvements were like much higher. In the case, were quite dramatic, and also consequentially better throwing distance than providing the knowledge of results. So one of the potential takeaways here is that providing knowledge of performance is going to be valuable when you're dealing with a skill that requires discovering a specific movement pattern. So if you're receiving information about how to tweak and constrain that pattern, you're going to get value out of knowledge of performance style feedback. Okay, so we've been talking about differences in the type of feedback that you should be given. So here we're going to focus on, okay, we've got a particular type of feedback. How should you give that feedback in order to obtain optimal training results? So factors that we're going to be looking at, and it's been looked at a few times in the literature, is the length of delay you should give between completing the movement and then providing the feedback. And there's some and there's mixed evidence in the literature promoting this one way or another. Okay, so one of the things that has been found in the literature a few times is that if you give knowledge of results feedback immediately, or or very shortly after performing the action, it can actually have a negative effect. That if you actually wait a couple of seconds, or in this particular study, waiting 3.2 seconds, then you end up seeing much more benefits of providing knowledge of results. So this research suggests that if you want to see better performance at retention, giving a little bit of a delay between the finishing of the action and the actual performing of the action is going to have some positive consequences, and we'll touch on some of the theory of why that might be the case. So the main way to think about why this is the case, and this is the interpretation that Swinnen has given and a few others have discussed, is the reason that you would want to wait a few seconds is that you would want to allow the person that just performed the action to engage in the process of processing their intrinsic feedback. So independent of whether or not they receive external feedback, whether or not they receive augmented feedback, the athlete or patient is going to get intrinsic feedback from their own sense of how they did it. And according to this theory, according to Swinnen's theorizing, it can take a few seconds for that intrinsic feedback to be processed. So if you immediately give feedback yourself, you're going to interfere with that kind of process. Now, there's been other studies that looked at what are the potential benefits if you give knowledge of results feedback like more than a few seconds out, or a few minutes out, or significantly later. I've given you a reference to a review paper that's cited in the textbook. When they've looked at various studies throughout the animal literature, they found that whenever you give knowledge of results more than a few seconds after the execution of the action, in general, it has a negative effect. That it's actually going to have a detrimental effect on learning rather than a positive effect on learning. The similar kinds of studies when you're looking at human performances are not conclusive. There's subsets of studies that have shown that you can get like positive outcomes if you're providing that kind of feedback. Others that show no difference. Others that show negative effects. Okay, so the timing, like with the particular delay that you should apply, there's some evidence, but the evidence is a little bit mixed. The next topic that we're going to look at is what are the consequences of the way in which the knowledge of results should be given to provide optimal results. This particular principle of motor learning has like solid, strong findings. Okay, so the basic thing that we're going to be exploring over the next few trials, over the next few slides, is going to be: do we want to be providing feedback on every trial, or do we want to be providing it intermittently? And if we're providing it intermittently, what particular strategy should we use for providing it intermittently? And here's a list of 4 different methods that we'll be touching on over the next few slides that represent different types of techniques for providing feedback intermittently. I won't review them now because I'll be unpacking them in the context of the slides that we're going to be going through. Okay, so let's start by looking at a study by Anderson and colleagues. Here we're looking at a blindfolded aiming movement. So in this study, there's no picture available in this research that I could show you, unfortunately, but you're holding a stylus, and you have to move, you hold the stylus like a pen type device, and you have to move it across a table to get the stylus to stop exactly on a line that's a target line that's on the table in front of you. And we're going to train people to try and do this while completely blindfolded. So again, if you had your eyes open in this particular case, the kind of the intrinsic feedback that you get from your sight of seeing whether or not you hit the target is potentially going to make the kind of feedback that we're providing here not amazingly useful. So here we have a nice illustration of the point I was trying, a design that is implicitly connecting to the point I was making earlier. Okay, we've got two groups in this experiment. We're either going to provide knowledge of results about your distance error, about how closely your movement got you to the line, either on the end of every single trial or on every other trial. What they find is that the intermittent knowledge of results hindered performance initially, but produced better results at retention. Okay, what do I mean by this? If you're receiving feedback every single trial, when you're actually training to produce the task, you're actually going to see greater improvements while you're continuing to do that. But when I remove the feedback and test your ability to continue to accurately produce it, the fact that during training you had trials where you didn't receive the feedback is actually making you better at producing the task when you no longer have the augmented feedback. And we'll see this particular pattern of results illustrated more clearly when we're looking at other studies. Okay, here's another experiment looking at a similar kind of thing. So here we have participants learning to produce a specific pattern of movement. So they take hold of a lever that can only be moved in one dimension along a channel, and they move it along a tabletop. So it's actually quite similar to the stylus task. And they move this lever in order to manipulate a cursor on a screen. Now, when they so they have to create a particular pattern of movement. So in this graph here, we can see we've got the amplitude of the movement on the y-axis and the time on the y-axis. So we can see they so you've got the participants' movement, the movement that they are actually trying to produce. So we can see you go up, then so depending upon how this is arranged, so if you imagine that the top of the graph is left, you initially go left, then right, then left, then right, in order to produce the desired movement pattern. And then what we've got is that you're going to get feedback of how your movement related to a desired pattern of movement. So this is actually kind of similar to the cutting disc feedback that we saw earlier. Okay, so here's the manipulation. Participants are either going to receive this kind of feedback, where they produce the movement and then they get a tracing of their movement next to a tracing of the ideal movement, and they're either going to receive it on 100% of trials, so after each time they produce the movement, or they're going to receive it on 50% of the trials using a fading technique. Okay, so what do I mean by a fading technique? This means providing feedback frequently at first, and then you're slowly going to reduce how often you provide the feedback, so that by the end of the training, you're providing almost no feedback. So the volume of feedback is going to fade away. So here's some. So here's the results. So we're going to be measuring the error. So if you look on the graph on the left, with the relationship between the goal movement and the participants' movement, you can imagine that the amount of deviation, how far you've deviated from the expert's movement, the goal movement, and you add up all of those differences, that's going to give you the amount of error that you're making. So, so on the graph on the right-hand side, the higher score there, the greater amount of deviation you have away from the ideal training. So we've got two different lines here. We've got the 100% and the 50. If we look on the acquisition, we're seeing we're seeing the different blocks of trials. So on each block of trial, each block we're receiving 12 trials of practice. So you've got 12. Whoops. We've got 12 trials of practice going into each of those data points, and you can see that with the practice, their error is going down and down and down as they keep practicing. Now, one of the interesting things that you see is that you don't see a reliable difference between whether or not you're receiving the practice on 100% of trials, or you're receiving the feedback on average on only 50% of the trials. So that's the acquisition. The important thing we care about is the retention. We want someone to learn something, to be able to walk away and to come back and to be able to produce it. So, and here we've got you can see in the retention area, we've got IMM that stands for immediate, which basically means that we're going to run a block of trials immediately following trial 16. And then we've got a set of trials where we're going to ask you to walk away and then come back later. So in the immediate condition, where you're going to perform the task with, for 12 trials without getting the feedback, we end up seeing you get slightly lower error with the 50% feedback. When we look at the delayed, we see that we see pretty dramatic changes. That if you have received the fading fading technique feedback, you end up with much less error in your actions. So what are we learning here? We're learning that in terms of immediately what you see during training, we don't see that much of a difference. But the consequences of having trials that don't actually have the feedback in them is going to have a significant, quite major influence on your ability to perform the task well when you walk away from the task and come back to it later. Okay, here's another task. So this time we're going to ask you to move a lever along a trackway in order to produce a goal movement time. So rather than producing a particular trajectory of movement that we were giving feedback on in the last study, here you're going to produce a movement, and the goal is to be able to produce that movement in an exact amount of time. We're going to have 4 different groups. Knowledge of results is going to either be provided on every trial, and here we're going to be providing information about how your movement time compared to the goal movement time. Or we're going to provide knowledge of results either at the end of each 5 trials, at the end of each 10 trials, or at the end of each 15 trials. This particular style of feedback is called summary feedback. So we're not giving feedback at the end of each trial. You're going to do 5 trials, and then at the end of that 5 trials, you're going to receive feedback on how you did across those 5 trials. And in the 10 trial case, you'll do 10 trials without feedback, and then you'll get feedback on how you did across those 10 trials. Okay, so here's some results. On the y-axis, we've got the absolute constant error. So the higher up you are in the graph, the worse you are. On the x-axis again, we've got the acquisition stage, and we've got the different blocks. In each different block here, we have 15 you're doing 15 trials of making the movement, and then getting feedback on your ability to on how the amount of time your movement took compared to the goal movement time. So in the 5 trial group, in a block of 15 trials, you would receive feedback on the first set of 5 trials, the second set of 5 trials, and the third set of 5 trials. In the 15 trial case, you would just receive feedback at the end of the whole 15 trials. Okay, so what do we see? We see across the acquisition stage, we see the errors for all types of feedback decrease significantly. And then when we look, when we stop the task, wait 10 minutes, and have people try and perform the task again without any feedback, and get them to do another 15 trials, we end up seeing the slight differences, but there's no, but it's not even though it'll make sense in a second, there's not clear differences between the groups. If we wait another couple of days, then we really see the consequences of what it meant to reorganize this training in a particular way. The two dots that are highlighted at the bottom are the 10 trial summary and the 15 trial summary. So we're actually providing the least amount of feedback in terms of the amount of times we're actually giving feedback for these particular groups, but these groups' ability to actually retain what they've learned ends up being significantly improved. And the interesting thing that's starkly apparent in this is if you look at the acquisition stage, that these two types of summary feedback are the top two lines, which means that during acquisition, they actually performed the worst. But it's only when you actually get to 2 days later and look at what the consequences of this training were that you actually see the benefit of arranging training this way. Okay, so let's look at another example. So similar kind of task. We've got your task is to rapidly flex your elbow and to produce a movement that has a movement time goal of 200 milliseconds. So like a dumb task, but we can study different principles to see the relative benefits of them. So here we're going to look at yet another type of principle about how you could organize the training, and we've got three groups. We've got a knowledge of results on every trial group, so you're going to get feedback about your time relative to the goal time. You're going to get the second group. You're going to receive knowledge of results only if you have an error in your movement that's greater than 5%. So if you have more than a 5% overshoot or undershoot of your movement time relative to the target movement time, we'll give you some feedback. Otherwise, we do not give you any feedback. And then another group where you provide knowledge of results only if the error is if you're 10% more than 10% above or 10% below the feedback. So this type of feedback is called performance-based bandwidth feedback. So here, your augmented feedback is only given when there's an amount of error greater than a particular range that you've specified. You're going to set a particular bandwidth where if you're performing anywhere within that band of performance, you don't get feedback. It's only when you fall outside of that band that you're actually going to give the feedback. Okay, what do we see in this results? When we actually go and look at the retention of these skills, if you give feedback on every trial, you end up with the lowest the lowest retained performance. If you only gave feedback when the error exceeded a certain band, you end up with the best level of performance. Okay, so going to go through another example. So so as you're probably realizing, as we're stepping through these, we're touching on different types of principles, different types of strategies for how you would organize the presentation of results. In general, what we're seeing is that if you don't give feedback on different trials, then you're going to see better gains at retention. And what I've been introducing you to in these different studies is different techniques for doing it. Okay, so here we have another study. College students are going to practice throwing a tennis ball to a target on the ground using their non-dominant hand. And they're going to get knowledge of performance about the amount of force that they're exerting on the ball, the degree to which the ball is being lofted up into the air, and the specifics of their arm swing. Here, what we're going to do in this particular style of feedback is we're either going to give feedback that is given at a self-selected frequency. So specifically, when the person who's being trained asks for the feedback, they know they can receive feedback. That they perform a trial, and if they feel like they could utilize some feedback, they will ask for it and they will receive it. Alternatively, the control condition for this study is that the patient or athlete in this case is going to be given feedback on a schedule which is determined by looking at a previous person that was trained in this task, and whenever that previous person had asked for feedback, the person who's being trained at the moment is just going to be given feedback. Okay, so this is self-selected feedback training. So the strategy here is that the learner is only going to receive augmented feedback when they ask for it. So here we see the results. We see the exact same structure that we've been looking at before. On the y-axis, we have the mean the mean amount of error in the throwing. The higher up you are on this graph, the more error that you're exerting. So as we go through the training, we see a decrease in error. We've actually got four groups here that where you're receiving knowledge of results in every trial, summary feedback, which is similar to what we were talking about on the previous slide, where you receive feedback after doing a bunch of trials, or we're receiving yoked feedback, where the scheduling of feedback is tied to how somebody else had asked for feedback, or the self-feedback, which is you receive feedback whenever you want. Okay, so we see a little bit of a jumble during acquisition, and as with a lot of these studies, it's only when we get to the retention test, so like 21 and 22 at the end, where we actually start to see the reliable changes. During the retention test, the lowest amount of error was achieved by those participants that were able to request the feedback whenever they felt like they wanted it. The yoked feedback and the summary feedback ended up being the same, and the least retention is seen by those participants that got knowledge of results on every single trial. Okay, so let's explore one clinical application. So here we're going to look at some research that connects to the idea or the scenario that you might encounter of when should physical assistance be provided to a patient outside of them needing it for their own safety in order to promote more effective training. So here we have a study where they're looking at a stabiliometer task, and this is a bit of apparatus that gets used in a few clinics to create a dynamic balance task, where you actually create an unsteady surface for someone to train their balance on. And so it can be effective for using for training muscles that were going to be useful for maintaining effective balance, and for training balance in general. Okay, so we're gonna study this task, and we're going to have two groups. We're going to have a self group or a yoke group. In the self group, you as the patient can choose when to use balance poles. So basically, when you're able to hold poles that will be in contact with the ground, that are going to allow you to further stabilize your balance. So you could imagine this as a parallel to when we were looking at the training that had the guy doing the gait retraining with both the brace and the parallel bars. The role the parallel bars were playing, or one of the roles the parallel bar was playing, was providing additional postural support and allowing a more stable behavior that would therefore allow the target activity to be more simply performed. In the yoke group, the participants are going to be told, okay, on this trial, I want you to use the poles. And the schedule of that is going to be determined by looking at taking a previous participant and saying, okay, with the previous participant, they asked for the poll on these trials. We're going to therefore give the poll at those exact same trials. So again, we're looking at self-selected frequency here as the concept, as the principle that we're using for scheduling our training. Okay, so what are the results? A self-selected use of the polls again enhances the learning of this task. So here's the essence of the results. If we look at the average time that the patient was able to maintain being balanced on this device without the polls, we see that if they were in the self group, they were able to stay balanced for just over 21 seconds. If they were in the yoked group, they were only able to stay balanced for 16 seconds. So look at the gigantic improvements here. We're talking like a 20–25% increase in the outcomes you're getting from the training. Okay, so why does intermittent training benefit learning? A major interpretation that exists out there, and a useful conceptual rule of thumb to hang your hat on a little bit, is the guidance hypothesis. So the guidance hypothesis states that augmented feedback may have both beneficial and detrimental effects on learning at the same time. Okay, so what's the positive effects of augmented feedback? So augmented feedback, the positive effect of it is that it's going to have the ability to guide the learner towards the correct response, that it's going to be able to get them into the ballpark of where they need to be. The negative effects of augmented feedback is that when you have feedback, when you have augmented feedback specifically provided too frequently, the learners can become too reliant on that feedback. That they will just focus locally on, okay, I performed the task. Here's what the feedback said. I'm going to just change my action based upon the feedback. If they get into that mode of relying too much on the feedback, you're going to end up neglecting the processing of intrinsic feedback. You're going to neglect the process of the patient or athlete learning to pay attention to how the movement felt like with respect to the outcomes that we observed. Now, this particular skill of learning to effectively interpret and process the intrinsic feedback that is going to be produced by trying an action is in and of itself a skill that needs to be developed. So if you have experience where you perform a task and you don't get feedback, where you're not just finishing a task and then you're being and you're just not thinking about what you did yourself, but you're just waiting to be told how you did, you're losing this opportunity to learn to understand your own movement and to detect information about how you're deviating away from performing that movement effectively. And that kind of experience is exactly the kind of experience that you need for retention and transfer. The kind of experience that you actually need to have actually learned the task. Okay, so what are some implications of the guidance hypothesis? So the guidance hypothesis says that if you have high knowledge of results frequency practice conditions, then the consequence that you're likely to see, and this is the consequence we saw throughout the results that we looked at, is we're going to see faster performance improvements. So while you're actually being trained and you're receiving the feedback, it's going to look like you're actually performing better. But the situation you're creating is going to create a situation where you're basically training an over-dependence on the feedback. In contrast with a low frequency of knowledge of result presentation, you're going to foster more problem solving and more independent exploration of the skills dynamics. You're actually going to provide the opportunity for incorporating that intrinsic feedback. Okay, so that is the end of this particular lecture. How are we doing for time? Okay, so we are doing well for time, and we can pick up on this. Just to open the window so I can see everyone. We can pick up on. We can go towards the next set of principles next class. So actually, let me stop the recording now. Stop and